welcome back to Innovation Nation. My name is Sarah Lawler-Muzquiz, and I'm so excited to have Mark Reed with us here on episode 2. Mark, please introduce yourself.
Hey, thanks for having me. Mark Reed, currently the Director of Support Services at Martin Luther King Jr. Community Hospital in Los Angeles, California, and also serve on various boards and committees with the International Association, Healthcare, Security, and Safety.
So everyone, Mark is an amazing thought leader. I wanted to have him on with us today because, you know, in response to COVID-19, Mark has done some amazing, innovative initiatives with his hospital to protect his people. And I want to just jump into it, Mark, if you're okay with that. I'd love to hear if you can give us an overview of some of the things that you had to do when COVID-19 hit and how you use technology to protect your people.
Yeah, so I mean, like the best thing about our hospital is we try to be very proactive. So we stood up a COVID task force early on in January when we started to get the news about this, in Asia and other places, and really trying to get ahead of this process. And during that, we started looking at what the options were going to be, what we were going to need, how we were going to respond. And probably the most unique thing that we've done early on in March was we deployed a thermal camera. They're able to screen up multiple people as they enter the hospital and instantaneously tell us, their temperature. So that way we're able to see, does someone have a fever? It's just part of our screening process. That way when people are coming to work or coming to the hospital seeking treatment or trying to come and visit, whatever it happens to be, we're just trying to be proactive in that approach and dealing with them.
So Mark, as we all know, COVID's very, touchy subject for a lot of people, right? And I am curious as to at what point, if you're allowed to share this, did you start, taking initiatives and implementing some new measures? Was it around the beginning of COVID? You're saying you were proactive. So do you remember when the hospital started implementing the measures?
Yeah, so I mean, right off in January, we started developing plans to have ready to, already pre-designed and respond. And then it was in February when, we started seeing cases here in the States, started seeing more cases in Los Angeles particularly. And then we opened our command center on day one when we first had our first positive case here at the hospital. And that command center got stood up, luckily we had the task force already and a lot of stuff in place. So it was easy to transition to that command center role and then just start rolling out and dealing with it. And then as we built out from, all right, now we have one positive case, now we have 2 positive cases, now we have, all these patients in the ICU on ventilators, now we have, oh my gosh, we're starting to get close to our bed capacity. All right, we're going to add extra beds. All right, we're going to do resource allocation requests for more supplies and vents and all of that. Luckily we'd already stood up the task force and then the command center, and we're able to really respond to the speed of the crisis. So
that's amazing. That is really mind-blowing because I remember working with my previous company. I was helping lead the COVID-19 task force, and it was, in response to everything going on. And that started for us in around March. And you guys started doing your things in January, which is extremely proactive. So that's an amazing effort that you led. I'm curious, how many people, roughly would you say were a part of your team in doing this deployment?
I mean, the task force consisted of pretty much almost all the leaders of the hospital. I mean, every director, our chief operations officer, vice president of ancillary, nursing directors, EVS directors, facility directors. We pretty much got all the stakeholders, involved early on because we knew this was going to impact the hospital in every which way you could think of. It wasn't just going to be, oh, well, nursing's really going to feel the brunt of this impact and they're going to have to figure it out. We knew, with dealing with COVID, it's going to take a whole different, cleaning process. Facilities is going to have to come in and help with, retrofitting negative air pressure rooms and, redesigning some spaces and putting up barriers and, security's role. We put in, surge tents outside of our ER. So we're pushing outside the hospital, deploying, Blue Med tents and DLX, ASAP 18 tents. that we now have to upstaff and, provide processes. And you don't think about it, originally, but then all of a sudden you're like, well, we got to support the staff that are going to be working there. Do we have Wi-Fi that reaches those tents? No, we don't. So luckily we had IT as part of the task force early on, and they were already, forecasting, all right, we're going to need Wi-Fi out here. We're going to need this. Facilities already, we're going to need power for the tents. We're going to need lighting. And really just getting everybody, from their expertise, pitching in and identifying their roles to support it, and really having that good response, I think, was key for us.
It sounds like you guys really followed the concept of teamwork and having everybody play their part to make the story great, because I'll be honest, working with a bunch of different customers that I was working with, it was challenging at times because some people didn't know where they fit into the picture, right? Or you had one person wearing 10 hats and then being spread too thin. And it sounds like with your efforts, it was really nicely done in a very efficient way. You mentioned, facilities. I hear you mentioned a little bit about, room pressurization. From an operational efficiency standpoint, would you say, today compared to then, would you say some of these changes have benefited potentially MLK in the way that they run some of their operations now today?
I would say yes. Obviously, the pandemic brings out the worst case scenarios, but it also provides the opportunity for people to rise up and respond, and really brings out the best in people.
Mm-hmm.
And so, dealing with all of this and just the processes, and we do things a lot differently, here in July than we did back in February. Our communication has improved vastly. And as we run drills, previously, pre-COVID, to be prepared, right? Communication was always our biggest, downfall. And I've been doing this for years, different industries.
Yeah.
It always comes back, the after actions, communication. So now, we do a great job. Every morning, Monday through Friday at 9 a.m., we have a leadership call. Everybody gets on it. We talk about, here's what's happened in the last 24 hours. Here's what we're expecting the next 24 hours. Everyone talks about, something that's went really good, some opportunities we have. And, we all work together to make sure that we don't have any stop gaps that are really going to, oh my gosh, this is going to shut everything down. But, everyone's aware, and it might not affect you, but it might not affect you today, but knowing what's going on and being up to date on stuff, it helps you in your, silo or your scope to be ready to pivot. So it's been beneficial for us.
Yeah, obviously no one feels like COVID has been a good thing. It's been very taxing on our world and the economy, but I will say, and I loved hearing, that, because one of the biggest things I noticed was people really did want to help each other, and visibility became key, right? Like communication and speaking with each other and collaborating, and not standing out of a meeting because you felt like it didn't apply to you. Everything applied to everybody now. We were all in this together. And I love hearing that your team really stuck with that and has kept that going even today. I know LA right now, I guess from your perspective, how is it over there? I'm currently on the East Coast, so I'm not near LA right now, and I'm curious how it feels today compared to the beginning of everything.
I think in the beginning of everything, it was very scary because we just didn't know, and as the months go by, we know more and more. The issue we're having now is, we did a great job, staying at home, flattening the curve. And then as we've opened back up a little bit more, we're now seeing, a significant increase here in Los Angeles. They're talking about, possibly the need to shut it back down again. And really we're starting to get close to trigger points when it comes to overwhelming the healthcare sector to be able to respond and have enough beds and things like that. Luckily, one thing I can say, Los Angeles, we are resource rich. The knowledge base that we have out here, I couldn't, our hospital has been successful with all of our people, but we couldn't have been successful without the community and the government, partnerships. Our disaster resource center through Los Angeles County EMS, they have just done miracles when it comes to supplies and resources and processes and information. Today we went and picked up an additional supply of N95 masks for our hospital through our DRC connections.
Yeah.
So having that network and that partnership is really what's been, I think, really made a difference. And not to mention just the community support too. There's not a day goes by that we don't get a phone call of, hey, we have some masks we want to deliver, or can we bring you guys cookies or lunch for the hospital tomorrow, or you name it. And that goes a long way. We're in this for the long haul. No one's expecting this to be over next week or anything like that. So to come to work day in and day out, to have that community support and them being there, they know they can't come here and treat patients, but you live 2 blocks away, that, hey, I can have a couple pizzas delivered to the hospital tomorrow and support the healthcare workers.
Mm-hmm.
And it's just amazing when you see that outpouring. I mean, it's been huge.
That's amazing. It's in times like these, it's so important that we support each other and be there for each other beyond the technology and the efficiencies we can create. I mean, just being there for one another, sometimes there's nothing better than that, that feeling of warmth and community. I mean, I know your hospital has been, at the forefront with a lot of this, and you guys have a huge community around you and a huge reputation for not just taking care of, your patients, but taking care of each other. And I love that about your, organization. One of the things I wanted to ask about that is a little more focused towards technology, of course, as this is part of Innovation Nation, I'd love to understand, Mark, from your perspective, like, as we know, you were confronted with something that nobody ever predicted happening before. How did you go through the steps? Like, what did the steps look like for you when it came to identifying and deciding which technologies you were going to implement? Did you do POCs, proof of concepts? What did that process look like for you, especially during a time of need like this?
Yeah, and that's probably been one of the biggest changes, I would say, since we've had COVID, is because before we would do a lot of research and proof of concepts and maybe test some products out or talk with peers. But now that we're moving at the speed of an epidemic, a lot of times we didn't have the time to be able to do a lot of that. So it was really like, I talked to my integrator, hey, this is the problem we're facing. This is the type of solution I'm looking for. Are you aware of anything? Picking up the phone and reaching out to some peers. Hey, look, this is what I need right now. What do you know about any of this? That's kind of how he came about with our thermal camera. I reached out to some industry partners we have, best in practice, best in the industry. And they said, hey, Mark, we don't have anything that's market ready for what you're looking for thermal temperature taking, because we're not there yet. And that was cool. I mean, I understand that, but also I need something right now. So, we reached out, we found this other vendor, this other product that they were using in a daycare, use it in daycares to make sure that parents weren't bringing their children with fevers to the daycare. So we put that in place, talked about it on Tuesday, had it up and operational on Saturday, and spent the next 2 weeks, verifying and making sure that it was accurate and meeting the needs that we were looking for.
Wow,
so
that is fast.
So that is now like the speed of the epidemic.
Right.
New technologies, now we're looking at mass detection and spatial distancing, making sure people are staying apart and stuff like that. So there's not a lot of stuff that's been on the market, that's been tested, that's been a proven concept, that you just now gotta we're going to take a chance on this, and because it's going to fill the need we have right now.
Agreed. I mean, I do have a question. You bring up mass detection regarding so with COVID, as you said, we're moving at the speed of light. There are things that are happening that we've never predicted. I would assume, and I guess maybe I'm making this assumption, I really am asking you a question here. From a compliance standpoint, I know there are a lot of new laws coming out and rules, right, that we have to follow, but how are you guys ensuring that once the people enter your facility, maybe it's employees, right, that they're still following the rules that they're supposed to follow? Do you guys have anything that you've implemented to help keep the compliance strong within the facility?
So we haven't deployed anything yet. I mean, the good thing is we're a hospital, right? So we're in the healthcare industry, so it's not hard to gain compliance from our staff when it comes to, wearing a mask or universal masking. But, you look outside of healthcare right now, Costco, Walmart's, they're now pushing that you have to wear a mask to enter their stores, their businesses. It's going to be tougher there because, you have a portion of our society now that is saying, no, we're not going to wear masks. We don't believe in that.
Right.
And so it creates a lot of confrontation, I think, at times. So that's where I think we're going to be leveraging technology to help with that. Because, you can't just put, a million security officers inside Walmart walking around and ensure everyone keeps their mask on at all times. That's not a viable solution. So you're going to look to technology to help you with that.
Absolutely. And that's a huge point. One of the things that we heard about, or that I heard about really, was how, a lot of hospitals have to man the entrances and the exits, and or really more the entrances, where they have stations now set up for when they check people in, take temperatures, have security manning that as well. And they're spending a lot of money to have to do that, to actually have the people there, versus being able to use the money to have the people not just stand there and check everybody in, but actually have them protect the facility and use them throughout the facility. You're now manning every single entrance. Is that something that MLK is having to do?
Well, I mean, the first thing we did was we restricted some of our entrances and really, tried to funnel people to that one central location to be able to do the questionnaire, the screening process, the temperature taking, all of that. Second, we were already staffing the main lobby because as part of our visitor management program, we want to know who's coming into our hospital, how many people are coming each day, where are they going, which has been really beneficial when it comes to contact tracing and things like that as well. So I would have recommended hospitals even before COVID that they should have, a presence at their lobbies and greeting visitors and checking them in and things like that, helping them, find the patient and where to go, and, just provide that customer service. And it's really that's the first touch point you have with your patients and visitors when they enter your hospital or even your place of business, right? So you should already have been doing that. And now you're just adding these additional duties of these questionnaires, these temperature taking. And that's where we've tried to leverage the technology. Some hospitals have attestations where the employee's able to do it when they clock in at the time clock. They have an app for the phone. Others, it's just simple, paper still or questions when they see a person at the front lobby. And that's each organization. They got to figure out what best serves their needs. But we're big on technology here. I mean, the easier we're able to make it on our patients, our staff, our visitors, the easier, just to streamline the process. Technology has always been beneficial for us when it comes to that.
Yeah, I think it's great. You guys are definitely one of the leaders with it. And I think that for the listeners and the people watching this, I do want to say to all you out there, if you are interested in learning more specifically around some of the technology that Mark has implemented at his facility, I would definitely reach out to him, especially on LinkedIn, right, Mark?
Oh yeah, please. More than happy to share. Right now, our biggest probably opportunity is, just people using their hands to open doors, having non-contact solutions. We deploy, some facial readers, so you don't even have to touch your badge now to open a door. That's been, we tested one out last year, pre-COVID. Now with COVID, we got more people, more departments like, hey, how do we get one of those? Because it's just so much easier when you walk by and it opens the door because it knows that's who you are.
Yeah. And how are you, I guess before we end, is there any tech right now that you're currently, if you're allowed to share, vetting that maybe would be interesting for the listeners to know about?
So we have the Alcatraz readers. So we're using those. We just deployed those again to our IT spaces right now. Like I said, we got multiple departments now saying, hey, can we get those over here so we don't have to worry about badge swipes and push pads and things like that. So we're looking to push those out some more. I think Alcatraz also came out with, or maybe they're coming out with a thermal option that we're going to be looking at, just to take temperatures as people enter spaces, just to capture that instead of just the one data point when you first walk in the hospital. Now we get multiple data points throughout the day for people.
Yeah.
Really just try to just ways we can find to keep everyone safe.
Yeah.
We know that COVID's super, you know, it's out there. People are going to get it. It can spread very easily. The other thing is making sure people are washing their hands. So using some analytics when it comes, they're at the sink, in the common areas, nurses stations, places like that. When they leave the room, making sure they're gelling in, gelling out. Using some of the analytics there to help us with that, because we know the hand washing compliance has been key to fighting COVID. So
Have you found any technologies that do, work along the lines of either the spatial, social distancing analytics, or you're saying the hand washing? Like, are you currently vetting some of those right now?
we're currently looking at a couple different vendors that are doing it. The key is it has to be compatible with our VMS. It
Yeah.
has to be, and everyone's coming to market right now with a bunch of solutions.
Yes.
And so again, moving at the speed of a pandemic, everyone can promise the world. It's just tough now identifying what is a real solution and what is like, we say we do this, but we're not, has it been tried yet? Where else are you using that?
Right.
And we're okay being the first one sometimes, but we want to make sure, we're doing our due diligence, and putting our resources in the right areas. So we haven't found it yet, but we're looking at a couple different ones, and hopefully we get one selected that'll do what we're looking for.
Yeah, I think a good topic to kind of end on, or just one, comment that you mentioned is, in this year of 2020 and all these new technologies coming out, obviously in response to COVID, it's hard to know what's good, what's real and what's not. I mean, I've received a lot of messages, whether it's LinkedIn or in general, of technologies that have just popped up out of the woodwork because it's an opportunity to capitalize. And I hate saying it. So, it's sad to say, to be honest, that that's what's happening. But I think that it's interesting because you mentioned, you're okay being the first if you have to be. But at the same time, I think it's important we remember that we're here to do this for the long run, right? We're not here to just buy for today. We need to buy for tomorrow. And I think it's important also for the listeners and the people out there that if you are doing that, really, I hope it's being done for the right reasons, and that it's not like the solution's going to last for a year and then all of a sudden it's end of life and millions of dollars are spent and then it goes away. Like, that's just not what we're here for, and I think that's one of the biggest challenges that the industry does face when it comes to new technology, knowing that it's going to last, because we've seen things come and gone for many years now.
It's tough when it comes to technology because we're always improving, right? Mm-hmm. So I could buy, our hospital is about 4 years old, and we're spending a lot of money to replace our cameras that, got put in when the hospital was built. But here we are 4 years later, and the resolution on those cameras is not what we need today.
Right.
So, that's having a good business plan, knowing that you're going to have a continual reinvestment in some of your resources. But like you said, like we bought a thermal camera, and they're not cheap for that single price point. Am I going to be using that next year? Am I going to be using it 2 years down the road? I don't know. I can't tell you that right now today. Mm-hmm. I know that the cost savings, when we did the math for the FTEs that would take, we've already recouped the costs. But if you fly over to Asia right now, they've been having thermal cameras in some of their malls and airports and places like that for the last couple of years.
Yeah.
That could be what America now looks like, post-COVID, or Europe post-COVID. I don't know, but it looks like we're headed that direction. So it's a good investment at the time.
Yeah, it's an interesting, I feel like we can keep talking forever because, there's so many things going on right now. And you bring up how a lot of this technology has existed already and it's been deployed, especially, led by a lot of the different governments across seas. And I think one of the biggest things that we always have tried to be wary of or be careful of is the Big Brother feeling, right? We don't want Big Brother's not watching you. Big Brother's protecting you, right? We're here to help you and make sure everybody's safe. And I think there's a fine line. It's tough to define it sometimes. And it's also tough. I've noticed that when you do implement that new technology, people don't always know what it is. The users of the building, and they could be confused, or unless what I've learned is it's really important that as you deploy, that the team deploying has a plan to educate the people in the spaces in conjunction with doing the new technology, because the last thing you want is to make people feel uncomfortable.
Yeah, you have to have a communication plan with anything. I mean, I don't care if you're adding a new camera in a you know, part of the hospital, or a new section of the building, or a new access control, or whatever it happens to be. You have to have a communication plan, rolling that out beforehand, so that way the staff that are going to be using it know. And that's part of change management too. Like, hey, this is new. Here's what's coming. Be aware of it. Here's the reason why we're doing it, and here's how it's going to benefit you. And I think that's key to getting that buy-in from those folks.
Yeah, I love it. I think change management is a perfect place for us to leave on. I think that concept, for another day, another time, one of my, something I think that is so important, and I think not just change management, but vision management, right? Understanding our end game, how we get there, communication plans. I love everything you've been doing with your hospital, Mark. So, I really appreciate you taking the time to spend with us today on Innovation Nation. And as we roll this out, I'm sure we'll have you again soon. And I would love to check back at some point once you do roll out some of those new technologies and learn about how that went for your team.
Sounds great. Thanks for having me. I'd be more than happy to share in the future.
Thank you, Mark. So for all of those out there, Mark is on LinkedIn, and we will make sure to tag him so you guys can reach out and connect with him. And we just want to thank everybody for joining in today. And thank you so much, Mark. It means the world that you joined us, and we're excited to keep chatting with you.
Hey, thank you so much, Sarah.
Thank you, Mark.